Over $1 billion of American taxpayer money has been systematically stolen.
Right.
And the massive organized fraud ring responsible for it leads directly to a diplomat who is, right now, serving as the president of the United Nations Security Council.
It's just a jaw-dropping intersection of, domestic crime and high-level international politics.
It really is.
And this deep dive into the sources,
Yeah.
it really forces us to look at the vulnerabilities in our public welfare programs. They're not just bureaucratic failures.
No, not at all. They're international pipelines for organized corruption. Welcome to the deep dive. Our mission today is to follow the money and, well, the people responsible.
Exactly.
We are analyzing a stack of sources that detail what federal prosecutors are calling one of the largest social services fraud scandals in U.S. history.
And this story, it starts with this massive theft in Minnesota.
Right, but as we trace the blueprint, you'll see it expands. It expands quickly across the Midwest and then somehow right onto the global diplomatic stage.
So the initial context, it's all set in Minnesota. And that really establishes the terrifying scale of the problem.
Just how big are we talking?
Federal prosecutors discovered welfare fraud totaling over $1 billion
$1 billion.
in stolen American taxpayer funds.
Uh-huh.
And this wasn't isolated. It was centered predominantly within very specific insular networks.
Mostly in the Somali community there.
Primarily, yes. The sources are very clear on that.
It's hard to even wrap your head around that kind of money just vanishing from programs that are meant to support vulnerable Americans.
And the numbers are specific. The sources confirm 86 defendants have been charged.
86 so far.
And 78 of those charged are of Somali ancestry. And that demographic detail is, well, it's central to understanding the internal mechanics of how these rings could operate for so long without being detected.
And that's where the story goes from being a local tragedy to really a national alert.
Absolutely. A whistleblower came forward with a warning.
And what did they say?
That Minnesota was, and I'm quoting here, just the tip of the spear.
Wow.
They're pointing to a similar multi-million-dollar Medicaid fraud syndicate that's been running for over a decade in Ohio,
Using the same playbook.
having clearly adopted the same basic criminal strategies.
So, okay, we're not looking at a one-off. This is a perfected criminal blueprint.
That's the key.
Our goal for you, the listener, is to unpack the sophisticated and often brutal methods that were used to loot these taxpayer funds. We'll look at the political vulnerabilities they exploited and then track that trail all the way to a high-ranking diplomat.
And ultimately, it all comes back to questioning the basic security of our own U.S. public welfare systems.
So let's start with Minnesota. The precedent of theft set there is, well, it's the foundation for everything that follows.
Its scale is truly shocking, and it shows the depth of the systemic failure that was required for this to go on for so long.
And we have to emphasize the language the sources are using. They consistently refer to this as stealing.
Right, not just fraud.
It's systematic looting of public funds. And when the scandal broke, the political reaction was immediate and intense.
It was. The level of brazenness that was exposed drew just swift condemnation. Senator Kennedy, for example, went on a rampage against the situation.
I remember that. He called it deeply disgusting.
He did, and he described the lack of oversight as clown world on steroids.
And that public outrage really reflected this sense that, the mechanisms of trust had just been completely shattered.
So the big question for everyone is, how? How did a scheme this big, $1 billion, operate for so long without anyone noticing? What was the systemic failure?
That's it right there.
Well, according to the sources, commentators cited two pretty complex factors. First, they point to declining assimilation in those specific communities where the theft was centered.
Which allowed the criminal networks to stay, hidden?
Exactly.
Opaque?
But second, and this is maybe more critical, they cite the fear of being labeled racist by officials.
Wait, hold on. The sources are suggesting that political correctness, the fear of backlash, actually prevented routine investigations into highly suspicious activity.
That's the argument being made.
Yeah.
Yes, it's a devastating indictment of the oversight process.
It sounds like it.
The sources argue that this reluctance, which stemmed from political sensitivity, it effectively gave these fraudsters a pass.
A free pass.
They were shielded until the scale of the theft, the sheer financial black hole, it just became too huge to ignore.
So the vulnerability wasn't just in the paperwork.
No, it was in the enforcement itself.
And that reluctance let criminals use American funds like their own personal checking account, We also saw former President Trump weigh in.
He did, very strongly. He linked the fraud to his policy decisions on migration from certain countries like Somalia.
He said the money was stolen and that the people involved should go to jail.
Right. And that political rhetoric frames the fraud as a direct consequence of, lax immigration and welfare oversight.
That context is important, but for our mission here, what's really fascinating is how that Minnesota blueprint,
The one that exploited those political enforcement vulnerabilities.
exactly, how it was then adapted and just executed somewhere else.
Yeah.
So let's pivot to Ohio and how criminals targeted healthcare dollars using that same template.
If Minnesota was the testing ground for these vulnerabilities, Ohio was the perfect opportunity to target healthcare.
Why Ohio?
Well, critics describe the Ohio Medicaid waiver system as, quote, one of the easiest in the Midwest to game.
So it was just ripe for the picking.
It was built on compassion, to help genuinely needy people get home care. But that design, that compassion, made it incredibly susceptible to criminal abuse.
And they monetized this vulnerability through a systematic scheme. How did it work?
It's a two-part process, and it all focuses on fabricating medical necessity. The first crucial step is putting immense pressure on clinicians.
Doctors and nurses.
Exactly. Pressuring them to rubber stamp approvals for home health care, often whether the patient actually qualifies or not.
And once you get that rubber stamp, that one signature, the payoff is huge.
It is. The sources detail that these fraudulent waivers can lead to payments as high as $91,000 per year per individual
$91,000.
in stolen money. So every false approval becomes a six-figure annual revenue stream.
So to keep that money flowing, you need a lot of patience.
And that's where the coaching and deception comes in. We have a shocking statistic on this.
Let's hear it.
Community insiders estimate that an incredible 99% of individuals receiving these home healthcare Medicaid benefits have been coached on how to fake a disability.
99%?
99%. They do not legitimately qualify.
That's not just a few opportunists. I mean, that is a massive organized structure that exists purely for theft.
And the evidence is often just hiding in plain sight.
What do you mean?
The sources point to this memorable and, frankly, infuriating example of patients who are supposedly bedridden.
Right, severely disabled.
And then they suddenly appear on social media, living their lives. Sometimes you see them dancing at a party.
So they're coached to act sick for official visits, but their own social media proves it's a lie.
Precisely. But the real logistical genius, if you can call it that, of this criminal enterprise is how they exploit one specific loophole.
The family caregiver rule.
That's the engine for the whole thing. It lets them monetize and insulate the scheme. The system was designed to allow family members to be paid providers, for continuous, culturally sensitive care.
Which sounds good on paper.
It does. But these criminal rings ruthlessly exploit it. They turn entire family units into guaranteed high revenue streams, even when no care is actually needed.
And because the provider and the patient are related and in this insular network.
Oversight becomes exponentially more difficult. It assures the stolen funds stay safely within the organization.
And the theft doesn't stop once you get a fraudulent patient approved.
No. The Ohio Attorney General's indictments from November 2025, they reveal these ongoing methods of what they call phantom billing.
Phantom billing. So billing for services never rendered.
It takes the fraud to another level. They bill for impossible hours. We see documented cases of providers claiming they were working long shifts for a client who was actually in the hospital at the time.
We're not even in the state?
Or the provider themselves was traveling out of state when the service was supposedly happening.
Is there a specific example from the sources, an agency caught in this?
Absolutely. The Hearts of Care Home Healthcare Agency. It was specifically accused of running multiple complex schemes.
And what were the losses from just that one agency?
A documented $344,602. And the indictments get really specific.
How so?
They detail forging client signatures on timesheets and sending completely unqualified people to provide what was supposed to be specialized care.
So there's a total disregard for the patients.
Total disregard. Which brings us to the question of what protects this system. How does this organized crime continue to spread?
It's fear.
It's fear, pure and simple. Whistleblowers who have tried to expose this, they report facing severe threats.
I read this in the sources. They were warned they could be.
Stoned to death if they expose the scheme.
That's not just intimidation. That is a tool of organized criminal syndicates.
It's used to enforce a total code of silence and to make sure their pipeline of stolen tax money stays open. And that is the necessary context as we shift to our final section.
Because this domestic scheme has now reached the highest levels of the diplomatic world.
This connection, it truly reveals the global implications of our own lax oversight. We have to introduce Abukar Dahir Osman.
Who is he?
He currently serves as Somalia's permanent representative to the United Nations. But more critically, as of January 1st, 2026, he holds the rotating title of President of the UN's Security Council.
So he's chairing the world's foremost body for global peace and security. But his history, according to the sources, leads directly back to the Ohio fraud syndicate we just detailed.
The corporate link is explicit. It's confirmed by public records. Osman was listed as the managing director or CEO of Progressive Healthcare Services, Inc.
A Cincinnati-based home healthcare agency.
That's right. He held that role from 2014 until May of 2019.
And what happened to Progressive Healthcare Services?
That company was convicted in 2022. Convicted of defrauding Medicaid of approximately $7.2 million.
$7.2 million.
Through improper claims.
Yeah.
And as a direct result, it was excluded from all federal health care programs.
Let's just connect the timeline here for the listener. Osman began his diplomatic job at the UN in 2017.
Right.
So his management role at the company, convicted of million-dollar fraud, overlapped with his diplomatic service.
For nearly 2 years, yes.
That proximity, that overlap, it just raises these immediate, urgent questions about accountability.
And U.S. officials are confirming this connection publicly now, which gives immense weight to the sources. HHS Deputy Secretary Jim O'Neill, he publicly confirmed the association.
And what did he say?
He just said more to come.
Which is ominous. And the reaction to this revelation was predictably furious.
It was. Elon Musk openly called for Osman's arrest.
And former UN Ambassador Nikki Haley, she used the scandal to criticize the UN itself.
She did. She said this was, quote, par for the course at the UN. Criticize America while stealing from Americans.
So critics see this as more than a local failure. It's an international embarrassment born out of our own failure of oversight.
That's the pivotal point. You have a domestic welfare system failure that let these criminal syndicates flourish.
Resulting in a $7.2 million fraud conviction.
All funded by American taxpayers. And yet, an individual associated with that very organization ascends to lead the UN Security Council.
So, okay, what does all this mean for the person listening right now? The takeaway is crystal clear.
It is.
These are highly organized, transnational schemes that systematically exploit the weaknesses in U.S. taxpayer-funded programs. And the losses are over $1 billion.
The blueprint relies on two things. First, exploiting compassionate rules, like the family caregiver rule. And second, exploiting systemic weakness.
Specifically, the reluctance of officials to investigate.
Which turns political caution into a financial shield for criminals. The need for aggressive action is just undeniable.
This highlights the absolute necessity for immediate, stronger audits in Ohio and really every state with similar programs.
Because the American people, the taxpayers, as the sources stress, they are hurting from this massive financial theft. It directly impacts the resources in their own communities.
Which brings us to our final provocative question for you to think about.
Right. If an individual associated with a convicted $7.2 million fraud scheme can rise to lead the UN Security Council, what are the true global implications of our lax domestic oversight?
And how much U.S. taxpayer money is potentially funding operations, be they political, criminal, or something else, far beyond our borders? All because of our own systemic failures.
The money trail definitely doesn't stop at the state line.
That is something to keep front of mind as these investigations continue. And as we wait for that, promised more to come from HHS. Thank you for joining us for this deep dive into the sources.